Hello everyone, today we will see everything you have to know about clinical pharmacists. So we will go in an order. First, we will see who is a clinical pharmacist. Where do you find this clinical pharmacist? In which branch a clinical pharmacist can work? What is the actual need for a clinical pharmacist? The role of the clinical pharmacist. How a clinical pharmacist can stand out from all the other hospital members. In which organizations clinical pharmacist jobs are offered. So to know everything, let's get into the video. First, we will see who is a clinical pharmacist. Pharmacists are drug experts. A clinical pharmacist is a person who takes this knowledge and applies it in the clinical scenario. A clinical pharmacist is a licensed practitioner with advanced education and training who practice all types of patient care settings with a focus on comprehensive medication management. They practice in healthcare settings where they have frequent and regular interaction with physicians and other healthcare professionals, contributing to the best possible health outcomes. Clinical pharmacists are gaining significant attention worldwide as important members of the patient care team. Where we can find this clinical pharmacist. Clinical pharmacists practice in many healthcare environments, including hospitals, inpatient and outpatient settings, emergency departments, community-based clinics, nursing homes, physicians' offices, etc. Clinical pharmacists can work in different specialties after proper training, certification in the respective department. Now a question arises, in which branch a clinical pharmacist can work. Clinical pharmacists can work as critical care pharmacist, ambulatory care pharmacist, oncology pharmacists, pediatric and geriatric pharmacists, cardiology pharmacists, etc. What is the need for clinical pharmacists? To provide a safe, efficacious and accurate dose to a patient. To consider the cost effectiveness of therapy. To improve clinical and economic outcomes. To increase health awareness and quality of life and reduce drug-related problems. Now let's see roles of a clinical pharmacist. To participate in medical rounds, giving appropriate recommendations regarding the appropriate choice of drug and dose dilution, rate of infusion in case of IV administration, route of administration, duration of therapy to physicians. Assess the status of the patient's health problem and determine whether the prescribed medications are optimally meeting the patient's needs and goals of care. To educate patients about their disease, counsel them regarding their medication, steps to improve health like exercise, diet, and advice about the best way to take medications. To identify and report ADR. To develop an individualized care plan for a patient with defined goals and monitoring. Recognizing untreated health problems that could be resolved with appropriate medication therapy. Promote rational use of drugs. To analyze drug-related problems and minimize the impact of DRP. Maintaining patient records with a total medical history and history of present illness. Therapy use, providing drug information and poison information, conducting health awareness programs, and many other roles and responsibilities. Clinical pharmacist, highly trained healthcare professionals, who provide a broad spectrum of services like treatment reviews, medications history interviews, ADR reporting, and patient counseling, which are usually done by more than one person if a clinical pharmacist is not present. Thus, she alone can do the work of a group of people. They also blend science, healthcare, direct patient contact, and computes technology through their work. Thus, they play a vital role in improving patient care through medicine and information. They provide regarding disease prevention, management, rational use of medicine, etc., which makes them different from other healthcare professionals. Happy learning. Thank you for watching.